My name is David. I'm a diabetic and I also have heart problems.
My name is Rita. Started out I had a double bypass, and then I think it was 6-8 months later I'd have 2 stents put in there.
My name is Charles. I had heart surgery, half of my heart disintegrated. Virtually I was confined to a wheelchair. I couldn't walk at all.
Well, I had neuropathy real bad. I had no feelings in my feet.
I was just really, felt like going downhill pretty quick.
Hi, I'm Greg Brewer. I'm an interventional cardiologist. I've worked in Knoxville for 16 years. Enhanced external counterpulsation is a technology that's been around for almost 50 years. And what it is where we strap these like blood pressure cuffs. They're placed on the thigh, on the calf area, and in the buttocks area, and the legs are squeezed to the rhythm of the heartbeat. It helps unload the heart so that it can pump more easily, but also creates a back pressure so that the perfusion is increased during the cardiac cycle when most perfusion occurs. EECP is an FDA-approved, Medicare reimburses it. There are specific indications for EECP, and it's for patients that we classify as either class 3 or class 4. That's a patient that has symptoms at rest, that's class 4. Class 3 is symptoms with minimal exertion. These are people that are maximally medicated, have had bypass surgery or stents. They've recently undergone a heart cath and have demonstrated that they have territories of their heart muscle that cannot be improved with surgical procedures such as bypass surgery or stent. The target audience is also people that have been told they have coronary artery disease that are inoperable, that they never had bypass surgery, but their coronary anatomy is not amenable to stenting or to bypass surgery. The other candidate for this is the person that has also experiences congestive heart failure. That's a condition of volume overload where they have profound shortness of breath and weakness and fatigue due to weakened heart muscle.
Dr. Brewer recommended that I do this treatment.
And I said, sure, I'll try anything that'll help me.
Well, I didn't know a thing about EECP till they called me and asked me to try it.
I guess I was afraid that not knowing what it would do with my heart or to my heart as it worked.
They do to check your blood pressure, your oxygen level, and check your weight before you get into the bed the first time. So they hook you up with the monitors, and then they hook you up to the cuffs. It's a blood pressure cuff that pushes pressure on your legs from your ankle all the way up to your waist, and it really gets the blood circulating back towards your heart. It starts at low pressure, then when you get to higher pressure, it's a little uncomfortable, but you know, it's nothing you could live with.
I don't know how to explain it, but it pumps. You can hear it pumping, you can feel it, and you can feel a sensation from it going through your whole body.
I was just sort of really nervous, but once that it started doing the pumping and things like that, and Beverly taught me through some of the things, tell me what it was doing as she was doing this and that made me more comfortable.
There's no pain. I've never had any pain with it.
The first day was great, and it got a little tougher as it went on, but it started doing better and better in the end.
Most wonderful thing I believe medically they've come out with other than surgery.
The first time, I guess I was really tired afterward because I guess my body just wasn't used to that much blood flowing as the way it's supposed to.
What EECP does is enhances the effect of vasodilation to improve circulation to the heart. There's also been some evidence to show that it improves circulation to the brain and to the kidneys. It can revitalize old pathways. It improves the circulation by dilating collaterals. The way to think about collaterals is to realize it's like secondary streets, but on a microscopic level, those channels are always there. But this recruits them, makes them dilate to handle more blood. What's really cool about it is after a course of treatment, which is usually 35 treatments, 1 hour treatment, 1 hour per treatment, people enjoy benefits up to, a majority of patients enjoy benefits up to 3 years.
I've tried it and I've done 35 treatments and it's been very, very good for me.
I totally wish I had done it earlier.
And now, like I say, I can walk without a buggy, I can walk without a walking stick.
It has helped me on my diabetic stuff, on my sugars, and it also helped me on my neuropathy.
So I've not had to go in the hospital since. And so to me that is a big step.
The more treatments I took, the better it got.
And now, after having completed 35 treatments of this, I do have feeling in my feet.
If you were thinking about doing it, don't think twice, just do it.
Then when you get off of it, you feel like you've done a day's work. But an hour after it, man, you feel so good, it's just, you could jump up and down and holler.
I wish I'd known about this earlier.
You know, one of the things that has interested me in ECP is my dad. My dad is 75. 11 years ago, he had a heart attack and then got a 6-vessel bypass. For the past 8 years, he's gone in and had the EECP treatment. He's a diabetic, peripheral vascular disease. He's lost his right lower extremity to the ravages of diabetes. He has had this treatment for every year for the past 8 years. And I think it's made, every time he's had a subsequent heart cath, his bypass have demonstrated to be open. Now, I can't guarantee that that's what's going to happen with EECP, but I feel that EECP has been very beneficial to my dad. It has kept him alive. I mean, the key thing is I really do credit EECP with helping my dad maintain a quality of life that has been exceptional for somebody with his multiple medical problems.